Sex researcher, professor of human sexuality at NYU, and your daily scoper on things related to sexual health, sex education, and sex science. And today, this is one of my regular sex science news scopes where I tell you about a new study that just got published last week. Yes, it is class time indeed, John. So I have a really interesting study for you that busts a myth that a lot of people have, and prior studies have shown that people have, which is that people who have consensually non-monogamous relationships, open relationships, are actually more likely to have many different STIs, sexually transmitted infections, than people who are in monogamous studies. Okay, so that's what we're going to talk about today. It's a brand new study that just got published in the Journal of Sexual Medicine. And if you think that this would be interesting to other people, please click that Perry Buddy down there and invite your followers to this broadcast now. You can invite them on Periscope, you can invite them on Twitter, you can invite them on Facebook, whatever you want. Hi, everyone. For those of you who are just joining my name and who may not know me, how many of you are new to my scope? Say new if that's you. Mormon Doc? Who's Mormon Doc? I'm not Mormon. Oh, excellent. We have a lot of new people. Morning, everyone. Okay, so Johnny, Third Avenue Rocks, Ambassador Moore, Back Home 75. Excellent. Lots of new people. So hi, my name is Dr. Jana. I'm a sex researcher. I study casual sex, non-monogamy, and sexual orientation. And I teach human sexuality at New York University. So I'm based in New York City, and I teach undergrads about human sexuality. And what I do here on Periscope is I come back daily and do at least one scope a day on things that are related to sexual health, sex science, sex education, sex news. And so we have lots of good, interesting conversations with people. So if you don't follow me already and you think that this is, the content that I provide is something that is of interest to you, make sure you click that Perry Buddy down there and follow Dr. Jana. You can also find me on all other social media. Well, not all, but I'm on Instagram, on Twitter, and on Facebook. I share a lot of interesting information regarding sexuality. Yes, Masters of Sex, indeed. In fact, the New York Daily News last year published a piece about me, calling me New York City's own Master of Sex. So you kind of get free NYU level sex education by coming into my scopes and chatting with me. Awesome. Excellent. So thank you for inviting your followers. Thank you for all the hearts that are going up the screen. I love seeing them. And let's have a little conversation about this new study that just came out that I want to talk to you about today. So we often have this stereotype that people who are in open relationships, right? Relationships where the partners are allowed to have multiple other sexual partners, that and all of that is out in the open, everybody knows about everything. People believe that people in open relationships have more sexually transmitted infections than people in monogamous relationships, right? And previous studies have shown this, that people really think that if you're in an open relationship, then you're a cesspool of disease. And that if you're in a monogamous relationship, then, that's very good for your sexual health. That's a great way to be, to stay sexually healthy. 169. Now, new study shows that that is not the case. By the way, 169 followers, if you screenshot that, and tweet it at me, I will tweet it back, I will retweet it. So when 169 comes back, make sure you screenshot that. So, hold on, there's a couple of, oops, sorry, damn it, I blocked the wrong person. Okay, we'll unblock him later, and please, the trolls, come to me so I can block you. Excellent. So The new study that just got published in the Journal of Sexual Medicine by Justin Lehmiller, 169, because I love 69. It's just the appropriate number for my scopes. Here's what they found. So they got a sample of about 550 people who 550 people who they got from various different sort of online, websites. They looked for people on Facebook and Reddit and on Reddit, on Craigslist, not the casual encounters on Craigslist, but so various different websites, and they got people who were both in monogamous and non-monogamous relationships. And here's what they found. The people who were in non-monogamous relationships, in openly, honestly non-monogamous relationships, they had more sex partners over their lives. So on average, the non-monogamous people had 6.4 sexual partners, whereas the monogamous people had 3.9. So, it is what you expect, that that the non-monogamous people had sex with more people. However, they had almost identical rates of STIs, of sexually transmitted infections. Yes, so those are for total lifetime. 6.4 versus 3.9. Sexual partners as in intercourse. Hold on, let me just double check that that's what they asked. Yeah, they would just ask sexual partners. So the two groups had identical numbers or identical rates of sexually transmitted infections. In both groups, about 20% had some sort of a sexually transmitted infection previously. So, and then they asked about each individual STI. So they asked about chlamydia, gonorrhea, syphilis, herpes, hepatitis, trich, HPV, and HIV, and the rates were identical, right, between the monogamous and the non-monogamous people. And so the question is, well, why? These people are having more sex or sex with more people, yet they're not having more diseases. And the answer lies in additional data that they got, which is, yes, so of course the monogamous people, about 20 or 30% of them actually were not monogamous. They were supposed to be monogamous, but they were cheating on their partners. Two, they were the monogamous, the supposedly monogamous people were less likely to use condoms if they were having sex with other people. So they use condoms less often. Yeah. And three, the monogamous people were less likely to have gotten tested. So the people in open relationships, people in open relationships were more responsible in their sexual behavior compared to the people who were in supposedly monogamous relationships. And that probably accounts for the fact that they were not getting more diseases. Because, if you think about ideal monogamy, like perfect monogamy, right? Then more partners would end up in more diseases. However, if you're being more careful, and if the non-monogamous people are being more careful, and the monogamous people are not actually monogamous and are being less careful, then you end up with the same number of or same rates of diseases.